Assalamu alaikum wa rahmatullahi wa barakatuhu. Selection of comparison group. Internal comparison. Only one quad involved in study. Sub-classified and internal comparison done. External comparison. More than one quad in the study for the purpose of comparison. Part of radiologist compared with ophthalmologist. Comparison with general population rates. If no comparison group is available, we can compare the rates of study quads with general populations. Cancer rate of uranium miners with cancer in general populations. Follow-up. To obtain data about outcome to be determined, morbidity or death, mailed questions, telephone calls, personal interviews, periodic medical examinations, reviewing records, surveillance of death records. Follow-up is the most critical part of the study. Some loss to follow-up is inevitable due to death, change of address, migrations, change of occupations. Loss to follow-up is one of the drawbacks of the quad study. Analysis. Calculation of incidence rates among exposed and non-exposed groups. Estimation of risk. Incidence rate of outcome. Exposure status yes or no. A, B, C, D. A, B, C, D, and AC plus BC. Study quad and comparison quad. Incidence rate. Incidence among exposed A over A plus B. Incidence among non-exposed C over C plus D. Estimation of risk. Relative risk. Incidence of disease among exposed over incidence of disease among non-exposed A over A plus B, C over C plus D. Estimation of risk attributable risk. Incidence of disease among exposed minus incidence of disease among non-exposed over incidence of disease among exposed A over A plus B minus C over C plus D over A plus B. Smoking, lung cancers, yes. 76,930. Total 7,000. No. 3 yes. 29,997. 3,000. Yes. 73 and no 9927. Total 10,000. Find out R and ER for above data. Incidence of lung cancers among smokers 70 over 7,000 is equal to 10 per 1,000. Incidence of lung cancers among non-smokers 3 is over 3,000 is equal to 1 per 1,000. R 10 over 1 is equal to 10. Lung cancer is 10 times more common among smokers than non-smokers. ER is equal to 10 minus 1 over 10 multiply 100 is equal to 90%. 90% of the cases of lung cancers among smokers are attributed to their habit of smoking. Types of quad studies. Prospective quad studies, retrospective historical quad study, combinations of retrospective and prospective quad study. Quad study strength, we can find out incidence rate and risk. More than one disease related to single exposures. Can establish cause effect. Good when exposure is rare. Minimizes selections and information bias. Weakness, loses to follow up. Often requires large samples. Ineffective for rare diseases. Long time to complete. Expensive. Ethical issues. Thank you very much.